Hello, everybody. My name is Jon Mathias. I am the co-chair of MPN Voice, which is the UK-based patient support group. And I'm also on the MPN Advocates Network Steering Committee. So today I'm going to talk to you about the landmark surveys, which are a very important piece of research that was started 6 years ago and has been continuing ever since. So let's get into it. I'm going to tell you about what the surveys are, what they're all about, what their principal findings have been. I'll say a few things about how I think advocates can use the findings from Landmark, and I'll finish up by explaining what's coming next in this series of research. Okay, so Landmark surveys are all about the effect that MPNs have on patients' lives. Now, as an MPN patient myself, I know the effect, and all of us know the effect that these illnesses can have on our lives, and it can be a huge effect. However, what Landmark has done is produced a series of systematic scientific studies into that impact and fully document the burden that MPNs represent in some detail. So far, there have been 3 phases. The original study in 2014 interviewed 813 patients and over 450 physicians based in the US. 2 years later, in the international Landmark study, 700 patients were interviewed, over 200 physicians in other countries, in Australia, in Canada, Germany, Japan, Italy, and in the UK. And then most recently, 2 years ago, the international Landmark expansion interviewed 506 patients, 240 physicians in Asian countries, in China, in Turkey, in Russia, Taiwan, South Korea, and Saudi Arabia. So by now, we have a survey of well over 2,000 patients, 800 plus physicians, really around the world. And so it's a genuinely global picture of MPNs. So what was studied? Fundamentally, the studies looked into symptoms, the emotional impact of MPNs, the impact of MPNs on daily activities, the economic impact, and lastly, the patient-physician relationship. And the findings have been. So the first thing to say is that the Landmark surveys have produced a really huge amount of quantitative information, all of which is published and available online. All you need to do is to Google Landmark MPN, and you will find what you're looking for. However, I will be able to summarize very briefly what the findings have been. The next thing to say is that although the findings have been conducted in 3 phases in different parts of the world, the findings have been generally consistent with each other. There are some minor differences between what patients in different countries have reported, but generally speaking, the findings have been consistent. And I'll just summarize some of those. So in terms of the impact of the disease, as we know, MPN symptoms significantly affect patients' quality of life. That's something that we all know, as I've said, but these surveys really prove that fact. The dominant symptom is always fatigue, although a wide range of other detrimental symptoms have also been documented. One interesting aspect is that some MPN patients, in fact, I think this was mostly ET patients, did not actually know that some of the symptoms they reported were related to their MPNs. So in terms of emotional and social impact, nearly all patients reported an impact on those aspects of their lives. And in terms of daily activities, again, including family, social, sex life, for instance, patients reported a significant impact. In terms of economic impact, many patients had to reduce their hours at work. In fact, this was 59% of myelofibrosis patients. And in fact, between 11 and 31%, depending on which illness they had, between 11 and 31% of patients had to leave their job because of their illnesses. So again, a very, very significant economic impact. Now, looking at the patient-physician relationship, some interesting observations here. So the first thing to say is that most MPN patients are really satisfied with their physician relationships, communication and treatment of their conditions. Okay. However, some differences in treatment priorities arose and were observed. So, for instance, myelofibrosis patients prioritized the progression of their disease. That's what their primary goal was in terms of treatment. While, on the other hand, their doctors were primarily concerned with managing symptoms. So quite an interesting difference there. And similarly with polycythemia vera patients, again, most were concerned with the disease progression, but their doctors were primarily concerned with making sure that they were doing things to prevent thrombosis, strokes, etc. So again, an interesting difference in the way that patients and doctors kind of perceived the importance of treatment. Now, another interesting aspect of this is that nearly 90% of patients said that they got their information about MPNs from the internet, okay, which is, I think, not surprising in this day and age. However, only 25% said that they got their information from their doctors. So again, a very interesting observation about the way that patients receive information, and probably not confined only to MPNs. I think this is probably an aspect of the way that patients with chronic diseases tend to think about where the best information comes from. But nevertheless, these surveys really proved that point. So in terms of conclusions, the first thing I'm going to point out is a direct quote from the original paper from the Landmark survey. So, and the quote is this: MPN treatment considerations should include reducing the symptom burden, as well as improving quality of life and productivity to enhance the overall health and lives of patients with MPNs. Now, that seems like an obvious thing to say. However, it does go against what the sort of existing thinking was about MPN treatment at the time. Most were concerned with endpoints concerning blood counts or particular aspects of the kind of the disease management. And one of the things that Landmark has really surfaced is that treating reducing the symptom burden should be a much higher priority. Secondly, it's clear that there is a need for improved patient-physician communication, especially as we've seen regarding treatment goals. And then lastly, and this is the reason that I've got this little graphic on the screen here, there is a definite need for standardizing the way we assess symptoms and monitor them on an ongoing basis. And the graphic here represents the MPN 10 scorecard system, which has been widely adopted and should be much further adopted in other settings. So, what would I say would be the advice that I could give to advocates based on the Landmark surveys? Okay, the first thing I think is that we should encourage patients, when they're talking to their doctors, to emphasize the impact that their symptoms have on their lives. This is probably something that doctors are aware of, but it probably doesn't come up, generally speaking, in meetings between doctors and their patients. Reportedly, most most meetings like that tend to focus on blood counts, on how the disease is behaving. I would say that we should encourage patients to talk much more about the impact of the illness on themselves. Next, we should always advocate for better patient-physician communication. If you've been to MPN Horizons meetings over the years, you know this is a high priority for us. We've often done role plays, for instance, that demonstrate what can happen when communication doesn't work properly. So I think this is something we should always be talking about and advocating for. And then lastly, on a practical level, I think promoting the use of MPN 10 as a standardized method for tracking symptoms should be something that we should be encouraging everywhere. Okay, so in terms of what's coming up next, what's being known as Landmark 2.0 is going to focus on primarily myelofibrosis and polycythemia vera patients. And for each of these illnesses, we'll be focusing on slightly different aspects of the treatment. So with myelofibrosis, we'll be focusing firstly of what happens at the time of diagnosis, initial diagnosis, then when treatment is initiated, and then as treatment is managed on an ongoing basis. With PV, it's slightly differently. With PV, we will be looking at the point at which therapy is started, cytoreductive therapy is started. We'll then be looking at the point at which second-line treatment, so when the first type of treatment has run its course, then thinking about what happens with the next phase of treatment, and again with the ongoing management of the disease after that. Across all of these things, we consider how diagnosis and assessment is done, what happens during treatment visits, the overall disease burden, again about the communication between doctors and their patients, with how assessments and monitoring are carried out on an ongoing basis, and then the overall treatment experience. So this is what's coming up with the next phase of Landmark, which should be getting started in 2021. Okay, and if you would like to know more about Landmark 2, then a few of us on the steering committee are involved in that phase of the studies. Okay, that's pretty much it for today. I hope that you found that interesting. And as ever, if you would like to know more about this work, please get in touch with us at MPN Advocates Network. Okay, that's all for now. Thank you.